What's up, good people? Let's talk about a very important subject, and that relates to the people who have gout. Gout is basically high uric acid in your body that deposits as crystals in your bones. Basically, it's not the bones, it's the joints between the bones. And sometimes you might see in extreme cases that it does find itself or find its way into the bone itself through the joint spaces as well, but that's in extreme cases, not usual finding. So my point of discussion here is that is there a vitamin that can help the people of gout, and how significant is that? Let's talk about it. That is there a vitamin or not? So the vitamin that I want to break here as a breaking news, or bring it here as a breaking news, is vitamin C. That vitamin C has been found to be a very useful vitamin and extremely essential vitamin when it comes to the people who have gout or hyperuricemia or high uric acid levels. Why it does that, how it does that, it relates to a lot of research and a lot of the pathophysiology of the uric acid cycle, and the formation of gouty crystals in your joints relates to the impact of vitamin C that it could have on reduction of your uric acid level, and hence your reduction of the chances of getting gout. So gout is a form of inflammatory arthritis, and it's been on the rise in the US because people of US consume a lot of proteins, a lot of meat, and that's what leads to the high uric acid level and therefore gout. So lifestyle, it's a big thing. So people of the United States and even UK and the rich places get higher and higher incidence of gout because they consume expensive protein related products that include basically the high uric acid level. And so it's caused by increased uric acid in the blood that builds up as crystals, or it crystallizes in your joints, and you do get flare ups, and they're so intense that the joints can turn cherry red and vibrate with intense pain, and the crystals being there, so it gets intolerable. And I have seen people with high uric acid level and gout attacks. They hate the gouty episodes or the flare ups. Or there are effective treatments. There are emergency treatments for that as well, and there are other continuous therapy treatment for that as well. So you need to stay in touch with your doctor. But my topic here is the role of a vitamin that can make a big difference in the life of gouty people. So gout can cause flare-ups that vary in frequency and severity, but sometimes people are not experiencing them at all. So that's why they keep taking all those things that increase your uric acid level, and we don't want that. And that's the problem, and that's why the lifestyle interventions are very, very relevant form of treatment or management in these gout patients. Vitamin C is the one that I want to target here. That vitamin C has few side effects, and for those with high uric acid level, it has been found to be a beneficial vitamin for gout patients or hyperuricemic patients, because it can reduce the likelihood of getting this condition. And you can find a full research study. I am here just doing the research review. So a recent publication in American Journal of Clinical Nutrition found that the people who consume 500 milligrams of vitamin C on daily basis, compared to the people who did not consume, were at a big edge, big benefit. So the consumption of vitamin C at this dose of 500 mg gave them a 12% risk reduction of getting the gout. That's a huge game changer. That's a huge benefit that I found out, and I want to relate to my audience, my patients of gout or high uric acid patients, that yes, you should consume vitamin C as a regular thing because it's gonna reduce the chances of getting high uric acid level. Even for those people who think that they might get high uric acid levels in the future because of their lifestyle, their diet, yes, they should also start taking vitamin C on regular basis. And the study of over 14,000 male doctors showed that men who were not overweight had the most significant reduction in the risk of getting this condition. So vitamin C works better if you have a good controlled weight. If you are obese, then vitamin C might not help. So that's why if you look at my other videos, you might find out that I have always been talking about the method of reduction of the weight or doing weight loss. So that's why, because weight is a big problem. I mean, being obese is a big problem. It's a root cause of many medical problems. That's why I hit that in many videos, because it just comes into the subject somehow. And even here you can see that vitamin C gives you a benefit of 12%. 12% is a huge thing when it comes to the bigger spectrum. But if you are an obese person, it's not going to help. And as part of the questionnaire, they were asked that whether they had ever been diagnosed with the gout, and other studies have shown that vitamin C reduced the level of uric acid in the people without the gout as well, and also broke down the uric crystals in the blood. And but this study took it at another further step to show that the supplement actually reduced the risk of getting this condition. So it helps from multiple directions. But again, you need to focus on losing the weight as well to get the best benefit from this kind of research, because that's what we want. In addition to lowering the levels of uric acid in the body, vitamin C can also minimize the inflammation, because that's what causes the flare ups. When you have, let's say, you have uric acid crystals here in this joint, or in this joint, or in your wrist joint, or anywhere in any joint, that thing is like a foreign body to your body. And that's what leads to an inflammatory response. And that's what causes you to get the flare up, the gouty attack, the pain that you don't want. And vitamin C can also minimize the risk of that. And that's what the research proves, and that's what we want to hear, because I need a vitamin. I need a something in my diet that's going to reduce the risk of giving me, or getting me towards the direction of hyperuricemia, high uric acid levels, or gout. And this is all summary here. I could go into a deeper and deeper depth, but I think this is where I want to stop. But please ask me questions if you have any in the comment section, and share the information, because we need to educate and empower the people around us so that they know that what problem do they have and what do they need to do so that they don't get into that kind of trouble, because this pain is very troublesome, very limiting. So thank you so much. Have a great day. Bye bye.